How to stop a period permanently. To permanently stop a period, you can have a surgical procedure to have your uterus removed, known as a hysterectomy. There is also a procedure that removes an internal part of the uterus, known as an endometrial ablation. These procedures are permanent and therefore it's important for a gynecologist to assess which method is best for you. 1. Hysterectomy. A hysterectomy is a surgery done to remove the uterus, which will stop your period, but also prevent you from getting pregnant. This surgical procedure is usually done in serious situations like endometrial cancer or cervical cancer. This option should be discussed with a doctor, as it's permanent and irreversible. 2. Endometrial ablation. An endometrial ablation is usually indicated for women who have heavy periods. After this procedure, the quantity of blood either reduces significantly or the period will stop altogether. After doing the endometrial ablation, however, likelihood of pregnancy diminishes significantly, as the procedure destroys the internal part of the uterus. Therefore, it's important to discuss this option with your doctor if you intend to conceive in the future. Why it's not possible to stop a period that has already started. It isn't possible to stop a period that has already started because the shedding process in the lining of the uterus has already started due to low levels of estrogen and progesterone. Once these hormones decrease, the internal lining of the uterus sheds and leads to the bleeding that occurs during a period. When to stop a period. If your gynecologist thinks that your periods are not beneficial due to medical conditions like anemia, endometriosis, or uterine fibroids, it may be necessary to stop menstruation for a prescribed time. In these cases, the gynecologist will indicate the best way to stop a period, usually until the condition is under control and the loss of blood is not a concern. Who shouldn't stop a period? Girls under the age of 15 should not stop their periods as it is important to observe cycle characteristics such as cycle length, the quantity of blood, and associated symptoms in the first years of menstruation. Observing the duration and symptoms of a girl's cycle will help to evaluate and assess for any concerns related to the reproductive system.